from the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. This Saturday is Race for the Cure. Many of you are going to be out walking that race. Baptist Health cardiologist Dr. Anthony Fletcher is here today with how physical activity benefits your heart and how to start exercising if you're not already doing so and doing a regular routine or regimen. Dr. Fletcher, good morning. Thanks for being here.
How are you?
This is something that we've talked about before, but I think it bears repeating because the benefits are so substantial to someone if they do this or start one.
Absolutely. And the Race for the Cure coming up this week is a nice entry into this topic. But exercise is very important. It's something that will help us long term, not just with heart disease, but in general. I mean, exercise has many benefits. It helps the aging process. It slows down the process of muscle degeneration. It helps you keep your aerobic capacity, flexibility, and activities. And it's not as hard as some people think it is. I mean, we basically don't have to go out and do long, strenuous exercise. Just walking 30 minutes a day, is a nice beginning. And if you can't walk 30 minutes a day, walk what you can, 5 minutes a day, and then build on that. I think the whole goal is to kind of start somewhere and then work your way up. And so if you start just walking, our goal would be to get you to 30, 35 minutes a day, with the ideal being for you to be at about 150 minutes per week of exercise.
So starting an exercise routine, what does it do for the heart specifically?
Well, specifically with the heart, it helps blood pressure, for example. And if you exercise, you're more likely to be better control with your blood pressure or not become hypertensive at all. For some of the people coming with mild hypertension, we talk about exercise, weight reduction, and salt restriction. It also plays a role with your cholesterol. It raises the good cholesterol, one of the few things we have that can make an impact on good cholesterol, and it may help lower the bad cholesterol. Diabetes is one of the risk factors we've talked about a lot in heart disease, and exercise can help you with your diabetes. Number one, it helps you keep your lean body mass, which makes it less likely that you may become a diabetic later in life. It also helps with the management of sugars. Your blood sugar levels are less likely to swing from high to low, and it helps with the management of how your body uses insulin, and so it's very important in terms of what it can do.
A lot of different ones that you guys have listed here. You mentioned walking, dancing, another one, which is a fantastic way to do it because it's fun, of course. Circuit weight training, aerobics, Tai Chi, another one on there, and swimming, another option, but you don't have much time left to do that before the fall weather comes in, so try to do that as soon as you can. Indoor swimming, absolutely. There are a few spots,
One of the things I'll mention too is water aerobics. This is very helpful for people who have orthopedic issues, knee problems, back problems, and so water aerobics is key. I mean, I really think that's one of the ones that we don't talk about enough.
Not just for the older generation, it can be for anybody, right?
Absolutely not. And if you're sitting still, you can exercise while you're sitting in your chair watching us this morning.
There you go.
You can sit there and just kick your legs. You can sit there and take some light dumbbells or some cans of soup and just kind of
move around,
move your legs. And so it's just important that you get that heart rate up and you keep it up, and that just helps you burn calories. One of the things that's important too, we talk about, I can't exercise long enough to burn off that donut you had this morning, right? Well, exercising while you're actually moving burns calories, but you increase your metabolism and you increase your muscle mass. So while we're sitting here this morning, you're burning off that linguine you had last night.
Yes, thank goodness.
So that's really good if you exercise on a regular basis. So key. Absolutely.
Thank you for coming in, Dr. Fletcher. Great to see you as always. There's a Baptist Health line on your screen.